Well, hello and welcome to today's webinar. This is an updated webinar from a presentation that we made on August the 14th. Today is the 15th of August. This is Mike Steckline, Director at the Networks at Theta Care Center for Healthcare Value. My guest is Michael Grogan. He's going to talk about the work that he's doing in Tanzania, and I'm going to let him introduce a little bit of the background of the work that he's doing, as well as the sponsoring organizations. So I'd like to introduce Michael Grogan, my friend, who I've not met in face-to-face, but I feel like he's a real friend, and we're working together to try to help with the efforts that they're doing in Tanzania. Michael?
Hey Mike, good morning, good afternoon, and good evening. Depends on what time zone in the world you are, but I greatly appreciate the opportunity to speak with you today. So today's webinar, once again, is a unique opportunity for us here in this small, not-for-profit, non-governmental healthcare provider to share our story and what we're doing to use Lean and its unique applications of both its theoretical side and its practical side to drive continuous improvement and ultimately to drive increased patient value experiences. So if we go to the slide number 2, which is as the agenda. So in the next 30 minutes or so, I'm going to introduce myself. I'm going to introduce the organization I work for. I'm going to talk a bit about some of our foundation in New York that's supporting us. For the interest of the listeners, I'm going to give some examples of how we're approaching Lean in CCBRT. I'm also going to give some examples on how folks can learn more, as well as give time for a Q&A session. And I guess that'll be between me and you, Mike, at the end. And then I'll have some of my own closing comments. So in the interest of transparency, I guess I have the purpose of why I'm doing this and why I'm connecting with the Theta Care Center as well as folks across North America and Europe, is I want people to hear our story. This is a very unique story for perhaps we may be the only lean healthcare provider in the continent of Africa the only lean healthcare provider in the continent of Africa that's actually experimenting seriously with lean thinking. I don't know if that's a fact or not. To be honest, it's even if we're 100th or the first, it doesn't matter. The important thing is that we need support and we need help to make this work. So I'm here full-time here on the ground in Tanzania. It's clearly we do not have enough coaches. We've got 400 people in the organization, and that's why our biggest need right now is for more people on the ground, whether you be a lean practitioner or in administration or in the clinical world, the physician world. We need more people here on the ground to help us develop the people capability. So if you can develop managers, develop leaders, there's the type of people we need. So number 1, boots on the ground. I know that invitation or that offer is not practical probably for 99% of our listeners. So therefore, if those that cannot come, I'm asking for people to possibly be interested in making a donation. And that donation will go to our Capona Foundation in New York, which would directly support our services here, and especially with our compensating people that can actually come here for a period of time. And just so we have perspective, that period of time could be as short as 2 weeks. Like this coming September, I've got a couple from the San Francisco Bay Area that are coming for 2 weeks. Or it could be like another gentleman I've got coming in September as well, who's coming for 2 months. So opportunities of the timeline all depends on the person's availability and how time they can get off, but certainly that's a big need here on the ground. And lastly, which is just as importantly, and we're very grateful for Mike and the team at Theta Care for giving us this opportunity, but we want more and more opportunities to spread the word. You can connect with people and you can reach out to people that I can't reach out to. So those are the folks that we want you to help us connect further with. So if I go to slide 3, the introduction. Perhaps maybe I'll introduce myself. I guess from maybe my accent, people are guessing where's this guy from, and if you have guessed Ireland, you're correct. I'm originally from Ireland. I have moved here to Africa in Tanzania in February of this year, full-time, working for this organization, CCBRT. Prior to that, I spent just under 4 years in Philadelphia, working for a manufacturing company, a pharmaceutical manufacturing company. And then prior to that, I spent under 3.5 years working for the same company, this time in the UK, in a city called Newcastle. But I'm Irish by birth, this to say. So I worked for a pretty large pharmaceutical company, Merck Pharmaceutical Company, and I was very happy with them. And I always said it would take something special for me to leave that organization. And I believe without a shadow of my doubt, CCBRT, this organization that I'm going to introduce, is that special organization. This is a small, very small, not-for-profit, 400 staff at the moment, that we say have an impact to the lives of almost 1 million people here, either directly or indirectly here in Tanzania. We have two focuses. Number one, folks with disabilities, and number two, maternal and newborn healthcare. It's an organization that has been established for the last 15 years, highly recognized in the developing world context in Tanzania. With multiple partners from North America to Europe to Japan to Australia that supply us with funds and technical expertise to enable us to deliver the services we do. Since our foundation, we've mainly been looked upon as a disability organization. CCBRT actually stands for Comprehensive Community-Based Rehabilitation in Tanzania. But since 2007, we have began a journey into maternal healthcare. And the reason why is the vast majority of the disabilities we treat are all preventable if the proper care was provided at childbirth. And for us, the prevention of disability is the number one thing that's in our mission statements. So we've undergone a new division in the organization in the last few years. We're building our own maternal hospital that's going to do something like greater than excess of 10,000 deliveries to 15,000 deliveries a year. And also we provide clinical and technical and also lean coaching support to the existing maternal healthcare sites in the city of Dar es Salaam. We have partners, and a lot of partners, as I mentioned, across the world, but the one partner in particular is our foundation based in New York, the Capona Foundation. So Capona is CCBRT in America. It's our foundation that is trying to gain more technical expertise, more financial expertise, our direction so that we can provide services to the poorest of the poor. And that is our target. And as I'll explain more towards the end of the presentation, the why I decided to leave my very comfortable life in North America and why I'm engaging in this one, which I know one will consider a mission. And I do consider it very much a mission work, but it has been so much, from my perspective, the most meaningful, most satisfying, most rewarding work that I've ever done in my life. And I feel very privileged and very honored that I get this opportunity to share with you today the work we're doing in CCBRT and the great, great human need we have to get more people involved in this effort. So I've been coming to Tanzania first as a tourist in 2010. It's when I saw poverty for the first time. It devastated me. And it broke my heart in many ways. And I've since then always looked for ways I cannot ignore this. I cannot not respond. And with this role I have in CCBRT as their lean coach, is in trying to promote lean thinking throughout the organization, I have really found for me personally how I can potentially make the biggest impact in this world. So I want more people to join, hence we have this presentation. So let's get into the meat of the presentation, and that takes us to slide number 4. And in slide number 4, I want to explain to you, the listener, just 3 elements of our lean approach here in CCBRT. So as you can see from the picture, I've actually just taken a few pictures. One is our version of the House of Quality, of Toyota's House of Quality, whatever one wants to call it. On the left on the screen, you see the picture of a team. That's the senior leadership team. And a diagram above that is the actual house they've drawn with their own hands. So when I first came here, the commitment of the CEO and his management team was number one priority for me. It's great that you say that you want this and you talk the talk, but truly I always said do not judge a tree by the fruit that it talks about, but the fruit that it bears. And that was a big thing for the leadership team of CCBRT. And in a lot of my coaching has been focused almost exclusively this year around the senior leadership team. So before I get into the detail of the leadership team, I want to go into slide number 5, the 3 things that I'm going to be talking about. I'm going to be talking about the leadership commitment and what that means. Number 2, I'm going to be talking about the BELT program in CCBRT. I know the Lean Six Sigma, whatever labels we want to call it, the yellow, black, and green belts program, it has got its controversies, but I want to show you, the listener, how we're using it here in CCBRT and how we hope to use that as a leverage point to infuse this thinking, lean thinking, even further. And then number 3, I want to talk about one-on-one coaching at the GEMBA. And apologies if that word is not familiar to folks out there, but GEMBA is basically where value is added. And whether that be in registration of patients, to the actual clinician's office where the patient is treated, or in the IT room where the systems are created and modified and updated to support our physicians, nurses, and our frontline workers to deliver a high-value, high-quality care for our patients. So that's the 3 things I want to go into some level of detail. So number 1, leadership commitments. So on slide number 6, you'll see 4 bullet points that I've highlighted. And this is from the senior leadership team. And once again, I have told, and I'll give one example personally here. I have told the senior leadership team many times that I am not going to be the one that drives this new way of thinking throughout the organization. It is them, the leaders, they're the ones that are going to drive this through. And so they need to become the teachers. And you can't teach anything if you've never done it before. So before they become the teachers, they must become the doers. So they are the first people that have gone through what I like to call waves of training, intense training with myself and hopefully others. What I want them to appreciate is get a deep understanding of it. For me personally, I was quite fortunate in my career that in the last 2 years of my career in America, I was coached one-on-one by a lean sensei, Eric Hager, and Eric spent 13 years in the Toyota production system. And definitely this day, I almost quote Eric, my sensei, almost on a weekly basis for sure. And I really understand the importance of that one-to-one connection. So for me, especially with the leaders, I wanted to focus on the few versus the many. It was very tempting and very easy for me to come into this organization and do death by PowerPoint. If one thing us coaches are pretty good at, well, the majority of us, including myself for the early part of my career, is death by PowerPoint. But then you get to challenge how effective really is that. And I wanted to take the leadership team on this journey where we can focus on the key areas we need to improve on and the key areas we need to learn on. So that kind of links us to the next slide on where our focus is. So we know that our organization, when you compare us to any healthcare provider in North America or Europe, we are so far behind in so many ways. In many ways, the African context, the African healthcare system is one of the most challenging, if not the most challenging humanitarian crisis on earth. So there's so much out of the lean toolkit I could throw at it. But for me, 4 things stood out as what we need to put our focus in. Respect for staff, problem solving, standards, and reflection. If you were to ask me what are the 4 things, what do I call success in my time here, well, how many years I spent here, it's deeply embedding this thinking, deeply embedding what respect for people is into the minds of the senior leaders of this organization. Because I really believe that is the foundation for all the great things that lean can give you, all the great things that total quality management, Six Sigma, whatever we were tempted to put the multiple labels on, but this is the foundation from what we built, a continuous improvement culture, starting with the leaders. And our primary focus is on safety and quality, because there's so much opportunities for our staff to get hurt in this organization. There's so much opportunities for our patients to get hurt. And our challenge, as in the same with a hospital in North America, whether it be regarded as number one hospital in the country or in the world, whatever that means, our reference isn't to compare ourselves with others, but how can we provide a culture that we're going closer and closer to our true north. Our true north, 100% of our staff safe, 100% of our patients safe. And that's a similar vision that a lot of maybe the listeners in the Healthcare Value Network have of that true north principles. So to re-emphasize again, leadership commitments was number one. And if I'm totally honest, I would not have left America, I would not have joined this organization if I did not see that commitment, especially from the CEO and his deputy, that they were serious about this. And without doubt they are. And that's why I'm so hopeful that this organization will create history here. So slide number 8 talks about the BELT program. Now, I am a product of the BELT program from the Lean Six Sigma world in my manufacturing years. And I have a love and hate relationship with it, which many of our listeners may relate to. And that's the case that I know so many so-called black belts that have not got the lean thinking principles and that use this program just as a checklist rather than for what it can be really used for. So I did not want to use that mistake in CCBRT, and by far I don't want to come across that I have mastered this. We're experimenting with this program to drive continuous improvements, whether the people's motive is recognition, their career, or patient satisfaction, reducing frustrations. And really, I don't care what their motive is, as long as they pick something and run with it. And since this year, we've trained about maybe 50 people on yellow belts. And yellow belt is just very simple awareness on scientific problem solving. I know a lot of people call it PDCA, Kaizen mentality, whatever label you want to call it. We just call it solving problems with a scientific perspective. That's a 3 days training, very hands-on where possible. One of my teachers always give me feedback, Michael, the less you talk, the more they learn. And that has really stuck with me all these years later. That the more I can get them to talk to each other and learn from each other, the more enhanced the learning will be. So we've got yellow, green, and black belts. And so what I've highlighted in bold is it's all focused around scientific problem solving. First, to get awareness as a yellow belt, so you complete 2 projects using the methodology. And then to green belts, where you become the lead of a project, 2 projects once again. And then in black belt, where you become the mentor of others. So maybe black belt is a few years away from us here in the organization, and maybe green belt is maybe next year's ambition. But certainly what I really want to highlight is that the leaders are teachers. So I'm using yellow belt, and maybe on reflection, the greatest benefit of yellow belt is not necessarily training all our 400 staff on scientific problem, but using that as a platform for our leaders to practice teaching, to practice coaching. So as much as possible, I'm trying to actually do myself out of a job, as all good consultants should have that goal. Or all good, I don't consider myself a consultant per se, but all good coaches should have that role to work themselves where they're not needed anymore per se. So I'm trying to delegate as much of the teaching to other people who have gone through the classes. So now I'm on, I think next Wednesday I teach class number 4, of day 3 of class number 4. In that class, I'll have teach someone who's in class number 1 and class number 2 who's now taking on teaching. So that's for me is fantastic, and that's what I want. The less I talk and the more I support the managers and leaders here become their own mentors. So that for me is an exciting part of the program, and which I encourage other folks that we can significantly learn from this. So it's an experiment, but I'm looking forward to learning from it. And the next slide, number 9, has just some images from the training. On the right-hand side is myself and one of my heroes, Dr. Brenda, who I did a podcast recently with Mark Rabin. We're working with 2 groups, and they're doing some, I won't say problem solving, because one of my other senseis always said, problem solving does not happen in a conference room. That's problem discussion. Problem solving only happens at the GEMBA. So we're helping the teams practice problem solving on a theoretical perspective on a real problem in the conference room, and then in between the classes we do go-sees with them, so they that's where they learn more of the lean philosophy and the greatest way to learn lean. But I'll talk about that in my next slide. And then the image on the left, it's one of the teams presenting to the other team. So that's an example of what I talked about previously, of the teams learning from each other. And that by far is exactly where I want to go. I want it, the less I talk, the more they learn. And then finally, GEMBA coaching. And so on this slide number 10, it's and for me, this is when I reflect on how I learn lean. I think by far is when I self-reflected after doing GEMBA walks with my sensei, that really was a significant leverage for my own journey. And I'm still learning. I never stop learning. So two examples there. One is from our hospital, our disability hospital. It's PSQDC. I don't know if people are familiar with that. Just some visual tools. P stands for people, S for safety, Q for quality, D for delivery, C for cost. And just tools I introduced at the end of last year to help them problem solve. So some visual management, red and green, and then every time there's a trigger for problem solving. So I take some leaders to those boards, and I challenge them to how they and their people see the problems, number one, and how they and their people respond to their problems, number two. And I found so much benefit from those exercises, whether it be the matron, bringing her and having her eyes alerted to the fact that there's so much problems that she didn't see, and then her eyes kind of, those aha moments when she sees this, that some of the actions that the team are taking is just on the symptoms and not on the root cause. So that's been very exciting. And then the picture on the right-hand side is actually taken outside of CCBRT, and is the time that me and Dr. Brenda visited one of the maternal hospitals here in Dar es Salaam with, I believe they had volumes of something like 15,000 deliveries a year, and we're helping them solve a problem of the partograph, which is basically the woman's record from when she goes into labour until she's discharged. And the problem in particular was it was not being filled out. And there was lots of assumptions, incorrect assumptions, especially on blaming people of the reasons why it wasn't filled out. So we helped them, those teams from the classroom, and then more importantly at the GEMBA, go see, ask why, show respect, and actually get fully grasp the situation. And then they began to appreciate that it wasn't the person's fault, but more, say, the system and how they can fix that. So that's quite exciting. And I got many examples that I'm willing to share in the Q&A with Mike afterwards. So in terms of learning more, I wanted to keep it short, this call. I want people to reach out to me. I'm on LinkedIn. Mike, I know you've blogged about me. Mark Graben has blogged about me and has allowed me to be a guest blog as well. And also on our website. So I've got the links to 3 sources of more information. CCBRT, of course, our own website. Our Foundation New York, for people who want interested in more. My own podcast that I co-interviewed with Dr. Brenda, an amazing woman, one of my personal heroes here in CCBRT, what she does for the women and children here of Tanzania. And Mark's blog has got also more links, as well as Mike's blog as well has got more links. But I guess in closing, going to slide 12, I wanted to kind of focus on one thing, and that's the why. The why someone in North America in a very comfortable context, in a very sometimes predictable life, or whether that be in Europe, why they should get involved in this type of work, or why they should care about this particular cause. In short, and I still learn, and there's a lot more for me to learn and a lot more for me to understand, but I sincerely believe that the African healthcare system is the greatest humanitarian crisis on earth right now. I can't think of a cause right now where there's so much unnecessary human suffering, there's so much preventable death, there's so much preventable harm that can be fixed. We can do something about it. When I saw poverty for the first time in 2010, it just devastated me. to see a child and a woman and a teenagers being born into poverty and almost feel helpless that they can't break that cycle. If I really reflect, almost the true definition of poverty around the world is the answer to this question: what happens to you when you're sick? And for these families in poverty, it is almost so heartbreaking when a mother goes in to give birth, to bring a new life to this world, and because of a broken system, that child is lost. Or worse, even worse still, we lose the mother. Or even worse still, we give the mother a disability. It's heartbreaking to see the tragic costs of this healthcare crisis. And as much as I deeply care about the concerns we have in healthcare in America and back in Europe and my own country, Ireland, the crisis here in Africa is on the scale of 100-fold. We're losing infants at 100-fold the rates. It's heartbreaking. But I really believe, and what gives me hope and what gives me energy every single day, and I thank God for this, there's this thing we call lean, this thing that we call total quality management, whatever label we call it. I sincerely believe that this is one of the biggest, if not the biggest, intervention we can make into healthcare around the world, but in particular the African healthcare system. I believe that if we can infuse this thinking into the managers and leaders of these organizations, that we will give them the thinking to solve their own problems. So many Westerners have tried to come to Africa and tried to help and intervene, and the good intentions is admirable. But the human cost of life needs us to deeply reflect in, are we making the biggest possible impact? Even oneself, wherever they are in the world, and they look at their own community, am I making the biggest possible impact? What is my legacy? You know, I never thought in my wildest thoughts that I would ever quit my career in America and move here. And a lot of people have come to me and asking me about the sacrifice that I've made. But I really don't believe that I've made the sacrifice as dramatic as people think, because I've gained so much from my time here. What I have gained is the definition of success, the definition almost of a meaningful, purpose-driven life. Every day I thank God for giving me the opportunity to come here and share this lean thinking that I was so lucky to have received. I was born in a part of the world that and most of our listeners, where we were in the 1%. We're in the 1% because of, I guess, the part of the world we are in terms of wealth. Also, because of that wealth, and that we also in the top 1% in terms of education. So we're all these listeners, no doubt, they are in the top 1% in terms of their education. But on top of that, I believe we're the luckiest people in the world because of this thing we call lean, this exposure that we've got to this thing called lean. So that puts us in the 1% of the 1% of the 1% even. And I believe we have an obligation at the core of lean is to knowledge, share, to how do we increase our contribution in our short time here on earth. How can we increase the quality of life for as many people as possible? So I ask people, in whatever way they think they can, reflect deeply. And if it's not this year, if it's next year, it's a few years' time, how can they get the opportunity to come here to share your talents that you're so lucky to have got, to share with people, leaders and managers here that desperately need it. And if that's not possible, once again, can we look to your foundation? If it's not possible, spread the word. Or if Africa is not your area of focus, how can you use your talents in your own community to spread this thinking, to develop people so they can solve their own problems? So from the bottom of my heart, I deeply thank this opportunity for sharing our story here in Africa. What we're trying to do is very unique, but it can't be done on our own. And we need help, and we need you to help us save mothers, save children, reduce harm, and make a difference in this world, and in a part of the world that desperately needs it. And that is my challenge to you. So Mike, I thank you. And now any questions that you may have on behalf of the listeners, I'm more than welcome to take those questions now.
Well, thanks, Michael. This is terrific. And anything I might add would probably take away from all the great comments you made. So really appreciate your willingness to stick with this process and see what we can do to try to help get the word out. I look at this as not the final time to do this. I think this is our starting point. And whatever kind of system you and I can create to try to create a critical mass of people that are interested in helping with this effort. That's what my commitment is to do. And as I follow up with this webinar, I'll be including contact information. So as people listen to this and are interested in acting on it or forwarding it, we'll be able to know more about what some of those channels of connection are. I anticipate that some people on the call and who view this recording might be interested in to know a little bit about, with the work that you've accomplished, what are some of the things, column results, either in terms of better quality, better safety, or results in terms of better behaviors from leadership. What have you seen, what have you experienced in those two forms?
Well, once again, thank you for your comments, Mike, and that's a great question, and it's I love that question in terms of, and I've been asked that multiple times, what do I, in my brief time here, I guess this is the third time I've been in CCBRT, as of February I've been here full time, what's the biggest change I've seen? Well, hands down, by far the biggest impact change I've seen is those slight changes in behavior of leaders. Now, one could say one of the most hardest things in the world to change is human habits, and no one can change anyone. We can only influence, coach, mentor, guide. Change has to come from within, and it is so exciting to see behavioral changes in the senior leaders here in the hospital. So some examples of that would be, well, the biggest thing is the blame culture and the assumption culture. That there was so much assumptions about what the current reality was, and so much assumption about the root cause of that. Attitude of staff was thrown out, and I really challenged leaders over a process of time, and it wasn't through one single conversation or one training or one GEMBA visit, but it's really challenging them to think, how many of our staff come to work to deliberately do harm to our patients? How many staff come to work to deliberately mess up a financial report or to cause frustration for their colleagues? And it's through a series of those questions, and mainly for them actually going to see themselves and grasping the reality of the situation, they realized that so many of their colleagues were working in this broken system. And they really empathized with them and seeing them saying, well, hey, even if when I was in that situation, I would mess up. So one of the highlights of that is actually when our CEO, so as part of the problem solving training, I tell them they have to pick two real problems, and the CEO and the deputy director of the hospital and the matron are on one team. And they picked the problem of something as simple as paper towels for drying your hands being not available in the washrooms. So from that, they had a kind of assumptions that maybe the cleaner she's lazy, she doesn't restock it enough. But after doing go see multiple areas, they got to realize and appreciate how much of a broken system the cleaner was in, how much information she didn't have, how much system needed to be fixed. So it was so exciting to see them making more clear what the standard was, communicating the standard, making the standard more visible, that those small changes, those system changes, had such a huge impact compared to their previous perceptions that it's a people issue. So by far and that's just one example, the people habits are by far the biggest impact I've seen. Like a results-based in terms of patient value, we've got multiple examples. Stockouts of supplies is another example of the hospital. We're actually, last year we were cancelling surgeries because we had, and postponing surgeries because we didn't have the right equipment at the right time. And it's simply by we did a Kaizen on the process and looking at where the process was broken, looking at where we had non-value added steps and how we could remove them, looking where we could implement Poka-Yoko devices to make error less, make the operator, set the operators up for success more. And there was multiple stakeholders involved in that. But that Kaizen was fantastic in terms of how we reduced the number of stockouts. But for me, once again, going back to the behaviors, the most powerful part of any type of improvement is its impact on people. And for hearing people to share their testimonies about the aha moments when it came to go see, those aha moments when they went to look deep into their assumptions and had them totally smashed in front of them. Those are the special moments that gives me a lot of hope and encouragement that that's the long-term development solution. That's where long-term growth of the organization is going to happen in those personal moments. So I can give more and more examples, Mike. So feel free to ask me for more.
Well, I think those are great examples, and my intent is to hear more of those examples from you and others that I know on your team we would like to get on the phone and have their perspective. So as I said before, I see this as one step in a process, and we've got a good start, continued start. This is not the last time we'll have this conversation, and I'm not the only person that's going to be joining you on calls to talk about what we can do to help. My goal is to help create a critical mass of people that want to partner with you, and I think that we've got a good start in getting that done. So what I'll do...
That's fantastic.
Great. So what I'll do is I will record this session for those that would like to listen to it, watch the slides, and also perhaps share it with others. And so for the purposes of our Skype call, Mike, what I'm going to do is turn it over to this part of the program and stop the recording. I want to thank all of our listeners for participating today.